I'm Stephanie Mitchell to present curriculum planning for the course Nurse NURS 6213 Curriculum Design and Teaching Strategies. From the concerns Healthy People 2030, I've chosen respiratory disease. I have quite a few family members with respiratory disease. I have asthma, and my father-in-law had COPD and emphysema. So I also have 3 of my 6 children vape on a regular basis. So the goals were to improve respiratory health. Over 16 million Americans have COPD. The objectives set by Healthy People 2030 are to reduce ED visits for COPD patients and to reduce hospitalizations for adult COPD patients. The cues and competencies I've chosen are under patient-centered, the screen is under patient-centered care, integrating coordination of care, transition and continuity for knowledge, skills, or communicating the things that are important to the patient to other members of the healthcare team. And attitudes are to value the patient's knowledge of his own health care. Also under knowledge, nurses need to be able to determine what will empower patients and their families to take better care of themselves. We need to engage patients in promoting health, safety, and respect their privileges to be as active or as inactive in their care as they choose to be. Other cues and competencies are quality improvement, choosing strategies that will provide the best outcome for the care setting that the patient is in at that particular time. These could be hospitalizations. It could be that the patient is seeing their primary or they're in a health department. Skills, seeking information about the outcomes to better serve populations in various care settings. And for an attitude, we need to appreciate that quality improvement is a continuous effort that is undertaken by all healthcare providers. Also, knowing that students are part of the system that affect care and outcomes for patients and families. We also need to know, students need to know, that there is a difference between opinions in a clinical setting and research and evidence-based summaries. What you think versus what has been proven to be factual. Skills are the use of flowcharts, diagrams, various tools to make the process of care easier, particularly in education of the patient. Locating various evidence-based reports, research articles, journal articles, things like that. And then attitudes to value your own contributions as well as others in healthcare settings, and to appreciate the importance of staying current with what's current in healthcare. AACN essentials that I've chosen are Domain 1, the knowledge for nursing practice. Knowledge for nursing practice is the integration and application of knowledge in various ways to promote health in a setting. The use of clinical judgment is an example of knowledge for nursing practice. Domain 2 is person-centered care. It focuses on the individual we're complicated, we're complex. This could also include the family that's important to them. It builds on a knowledge base and continues through the course of our care for the particular patient. And then population health scans the continuum from prevention that you might see from a health department to disease management that we would treat in a hospital setting. This also includes non-traditional methods, chiropractic, seeing the chiropractor, cupping, acupuncture. It can include nursing education as well. Things pertinent on the 2019 NCLEX test plan that I've chosen: safe and effective care management, that is providing care in a setting that is safe, treating problems as they happen, not creating more health concerns. Health promotion and maintenance: the nurse directs and provides the care that she gives, incorporating information that she's learned through history and assessment, as well as information provided by other partners in the interdisciplinary care plan, or care, other partners in interdisciplinary care. I apologize, I'm really struggling tonight. And then physiological integrity, basic care and comfort. I've chosen the concept of gas exchange to tie into respiratory disease. With the concept of gas exchange, an exemplar would be COPD. Thinking about the COPD diagnosis and the patient that would suffer from that, they would be at risk for altered nutrition. It's hard to eat when you can't breathe, so nurses would monitor their nutrition, assess for skin breakdown due to prednisone, assess for the ability to perform ADLs, and provide comfort to them, particularly in end stages. Integrated processes, teaching and learning, facilitate gaining knowledge, skills, and educational techniques, or presenting education to the patient in a way that it's going to promote a change in their behaviors. I've also used ASIN standards because I am at a community college and versus a college that nursing students are going to earn a baccalaureate diploma or degree. We use ASIN standards. So standard 4 is curriculum, and it states that there are outcomes based on standards, guidelines, and competencies that students are required to meet. Criterion 4.2, outcomes are show progression. This supports experiential learning. And then standard 5 is an outcome-based. A systematic plan is used to measure outcome. These tools are varied. So those could be case studies, exams, online activities, like online exams through ATI. CJ Sim has some simulations that I'm moderately familiar with. And these various design tools to measure outcomes are congruent with concept learning versus system learning. So the course is going to be patient-centered care. Expected levels of achievement for the course are that 75% or higher of the students will know how to identify the disease biologically, psychosocial effects, and how culture affects the disease process and the patient. Using various measurement tools like case studies, concept maps, and exams, students need to score an 80% or higher. Students will also identify patient-centered care strategies that will provide safe care. They need to show effective use of the nursing process and clinical judgment as well. So the learning objectives for the course are that the student can identify biological, psychosocial, and cultural needs that affect the care of patients throughout the lifespan by the end of the course. They will develop strategies based on the information that they gather, again, through health assessments, histories, observations, and testings. They'll use these combined with the nursing process and clinical judgment to develop their therapeutic communication and interventions that they will practice with a patient. So the learning objectives per the concept of gas exchange are that students will relate the consequences of impaired gas exchange to what the impaired process does to the body. They will identify risk factors and be able to educate the patient in their preferred method of learning on those risk factors, and they will implement appropriate interventions based on the findings. And so this part might be tricky. I'm going to go ahead and skip to a reference page. The only reference that is different on my page that wasn't provided in our resources is the reference to ASIN. So now I will try to find my map. Okay, I'm hoping, let's see if I can get this moved. So here is my map. We've got respiratory disease, COPD, QSIN, and knowledge, skills, and attitudes. Listed are those attitudes that you'll find in the PowerPoint. Skills also, and knowledge also listed in the PowerPoint. ASIN